This activity is a standing hip shift, and the reason we're performing this activity is so that we can balance out any tendencies we might have to favor a hip. So for a lot of people, we'll have a tendency to favor our dominant side, which for most of us is the right side. And what we'll do is we'll stand something like this, where we're actually shifting our weight over our right side and we're turning our body towards that side. So if you can look from this angle, what's happening is this hip is coming back a little bit and we're orienting our pelvis this way and our entire body can go with it. Then oftentimes we'll take the upper body and twist it back the opposite way. And so there's nothing wrong with that, but if you do that too often, you can often lose the ability to go the other way. So we want to balance that out. And how we're going to do that is we're going to have a soft leg. So knee is unlocked, not locked out. You're going to shift that leg back, that hip back, it's like you're sitting back with your back pocket, and you're going to allow your pelvis and lower spine to turn towards that hip. Okay? Then you could consider turning your upper body away without losing that, and that would be considered a hip shift, in this case to the left hip. So that's something to be aware of if you're someone that has a standing desk or you have to stand for your job or you're standing for any length of time. Just keep an eye on, are you shifting into one hip? If you are, try to shift into the opposite hip. Once again, thinking about soft knee, hip on that side shifts back. Okay, your pant zipper and your pelvis are going to orient towards the foot that you're shifted into, and you just want to balance those two sides out. So once again, that's a hip shift.